My name is Berenbrok, and I am the co-creator of Champ. I want to start by asking you to think about the biggest purchases of your life. What comes to mind first? Your home, perhaps your car? Would you believe it if I told you that after your home and your car, the biggest purchase of your life will be hearing aids? It is estimated that hearing aids can cost up to $9,000, and most are manufactured by only six companies around the world. But whenever I tell your 60-year-old self who has a 1 in 3 chance of needing hearing aids, that change is coming, what would you think? That's why my colleague Elaine Mormer and I co created CHAMP, championing hearing using accessible medication experts at the community pharmacy. Together, Elaine, as an audiologist, and I, as a pharmacist, created a dynamic educational program to train pharmacists how to help people purchase hearing aids where they never could before, the community pharmacy. Here's the need. Hearing aids have long been expensive and difficult to obtain, but federal law passed in 2017 is disrupting the industry by creating a new category of hearing aids to be available over the counter and without medical evaluation. These external forces from FDA will ultimately increase accessibility and affordability of hearing aids for nearly 20 million people who have mild to moderate hearing loss. Now consumers will have the opportunity to seek OTC hearing aids where they purchase other medical devices, the community pharmacy. This means that pharmacists with no formal training will soon find themselves selling OTC hearing aids. To draw a parallel, in 2009, community pharmacists were on the front lines of the H1N1 flu pandemic prior to being nationally recognized as immunizers. Today, nearly 43% of adults receive their annual flu shot at a neighborhood pharmacy. Our solution is one of a kind, it's first to market, and it's an online certificate program to train pharmacy students and pharmacy professionals how to help people seeking OTC hearing aids at the community pharmacy. CHAMP has delivered micro-credential badges to nearly 120 student pharmacists who have already completed our training program at the University of Pittsburgh School of Pharmacy. Our work was initially funded with nearly $30,000 from various sources, and we are currently poised to launch a healthcare education company providing education to professionals and to students. Our first offering will be CHAMP. We are currently seeking a CEO and additional startup funding to launch CHAMP to our initial market of nearly 140 institutions of higher education and nearly 60,000 pharmacy locations nationwide. Thank you.
So you talk about the healthcare education company, and it's quite interesting to see that law change. Question for you, similar to other certifications such as BCLS or ACLS, would the hearing aid certification require reaccreditation?
It would not require reaccreditation for the pharmacist as an individual. It would be a credential that they can stack upon their existing pharmacy license.
Hi, Luke. So my question is going to be around valuation for something like this. Can you just talk a little bit about what your projections are and like the time frame for that?
Sure. So in our initial customer discovery interviews where Elaine and I interviewed community pharmacists, they had no awareness that OTC hearing aids were coming to the community pharmacy. And with about 120,000 pharmacy professionals in the country, we have a large market to educate before regulations are passed. And those regulations were due in August of 2020, and they have not yet been published by the FDA. Similar education or certificates that allow pharmacists to give immunizations or allow to give COVID tests are valued about $250 per education program for that certificate.
Thanks, Luke. Were you done, Kalani? Okay. So my question is I guess around kind of competition. First of all, just to make sure I understand correctly, do pharmacists need a certification to be able to do this, or can they do it without? Now you're just adding a certification?
They would not need a certification to sell an OTC hearing aid.
Okay, so then I'm just wondering what's to prevent people who are already providing certifications for pharmacists from just adding this, since pharmacists, it seems like there are two kinds of competition. One is the pharmacist doesn't need it, they could just sell it. And the second is people who are already providing certification, if it ever becomes required, could kind of just add on a module. Can you address
Sure. Yep. To answer number one, pharmacists, if you've ever known one, are very type A. We have to be to keep people safe and with their medications. So, from our customer discovery, we found that pharmacists are very uncomfortable with this idea and they're seeking education to get on board, much like immunizations. There's a required certificate before we can give shots at the community pharmacy. And for number two, certainly someone could try to also provide an education certificate program. But Elaine and I feel that what makes us unique is that Elaine is an audiologist and I'm a pharmacist, and together we can have a very unique way of training people so that the pharmacists understand hearing from the audiologist, how we can work with audiologists, and how we can keep hearing aids out of people's hands who really are not eligible.